Hello, my name's Tom. I'm the lead podiatrist here at the Nantwich Clinic, and for the last 20 years I've been performing nail surgery locally. Initially I started with the health service, but for the majority of the time we've been doing it here in our clinic in Nantwich. So, nail surgery. It sounds awful, it sounds terrifying, but it's not. It's really straightforward, it's really simple. It's a procedure that we love to do. One of the reasons we love to do it so much is because we know the effect that it has on the patient. So if you do have an ingrown toenail whereby you've got slightly too much toenail, slightly too much toe, the nail pushes in at the sides and becomes painful, we know how painful it is. So it's disproportionately painful, it's famously painful. Now our treatment, you come in, you have a chat, you have an anaesthetic, you have the work done, you have the dressing, you have a chat, you go home, and the whole thing takes less than an hour. It's really easy, it's really straightforward, and it's pretty much pain-free. So, you will have 2 anaesthetic injections per toe, depending on how many toes you need doing. Most people have 1 toe done, so that's 2 injections. What we do is we warm the anaesthetic up to its body temperature. We don't let you see what's going on, but we do let you know what's about to happen. So nothing is taken by surprise. There's no shocks. Nobody runs at you, not attacked. We let you know. We have 3, 2, 1, sharp scratch. We put the needle in. We put a little bit of anaesthetic under the skin, and then we wait. And as the anaesthetic starts to work, we inject a little bit more, a little bit more, a little bit more, so you don't feel it. When the anaesthetic's in, what we do is we get a little piece of medical equipment called a probe, and we touch your toe to make sure that the anaesthetic has worked and you can't feel anything. When it's numb, what we then do is we take the shoulders of the nail off, the sides that are pushing in. We do as tidy a job as we can, so we take off as much as we have to, but as little as possible, so that when you heal from the surgery, it's a nice, tidy, clean job. When the shoulder of the nail is removed, it exposes a little piece of flesh at the bottom of the nail, and that produces the nail that shouldn't be there. When we do this, we then put some acid onto it, some phenol. It's very specific. We have measured doses in single ampules, very effective and efficient use of this acid, and it dissolves the little piece of flesh that produces the nail, so that when you recover from surgery, this piece of nail shouldn't regrow. So that's another reason why we love nail surgery so much, because it's not a treatment, it's a cure. No surgery is guaranteed, however, nail surgery is very, very successful, very high success rate with it. What's involved post-surgery? We put a dressing on your toe as you leave. We show you how to do it, so you can do it at home. We send you home with enough dressings so that we will see you in a week, but in between, you salt water bathe it and redress it yourself. If you've any problems or concerns, you give us a ring, you can send us a photograph, and we'll make sure you're all right. 2 weeks after the first dressing appointments, we see you again, and 2 weeks after that, typically, we discharge because it would have healed. Sometimes, it's so bad, the nail's so bad, so painful, if it's deformed, it might be necessary to take the whole nail off. If we take the whole nail off, once again, there's nothing to be concerned or worried about. The nail is sort of, biologically, we've semi-out evolved it. So it has a protective factor to it, but really you don't need it. When the nail's not there, you're not left with any sort of exposed wound. It's not hypersensitive. It's just got regular skin on it. And most people don't even notice that you haven't got them anymore. Dressing appointments. So after the appointment, we will see you 3 more times to redress it. Once after 1 week, 2 weeks after that, and then 2 weeks after that. When you get home, you'll need to take some painkillers because the anaesthetic will wear off. Everybody's normally fine. What we want you to do, what's really important to do, is that you put your foot up and do as little as possible. If you do that after the operation, you'll heal better and you'll heal quicker. You won't particularly feel a need to put your foot up because there's typically so little post-operative pain. But if you do that, if you put that time to one side, you'll heal better, you'll heal quicker, and it's much better for you.